for the upcoming Medicaid revenue costs that could shrink your hospital or medical practice revenue by 5 to 16%? I'm Alison Mueller, and in this episode of Wealth Prescription Weekly, we'll uncover how healthcare leaders are protecting their profit margins and boosting cash flow without cutting staff, changing suppliers, wasting time, or disrupting patient care. Joining me today is Kirk Conole from DCI Solutions. He's a principal there and the expert helping medical professionals recover $1,000 to $4,000 per employee per year through proven methods of healthcare cost recovery and expense reduction strategies. To simplify that, they turn your overhead into profit quickly. If you're a healthcare executive, practice owner, or financial leader looking to stay ahead of Medicaid eligibility changes or just improve your bottom line, this interview is your roadmap to financial stability and long-term revenue recovery. Let's dive in and explore how you can safeguard your bottom line starting today. Hi, Kirk Conole.
Yeah.
I want to welcome you to Wealth Prescription Weekly. And I have a weekly YouTube episode that I do for medical professionals. And I thought of you because there's a lot going on in the medical professional world right now. I'm getting a lot of questions because there's a lot of concerns about federal funding, things like that. And so I thought that while I know DCI and what we do with DCI applies to all companies that are a couple dozen to thousands and thousands of employees, that I want to be more specific for the medical industry, medical device industry today in our conversation. So can you talk to just a minute about the types of organizations, call it in my medical world, that you would be working with?
Yeah, I would say the companies that are typically anywhere from 2 dozen to sometimes several thousands are engaging our company for the purpose of generating very substantial amounts of money that they don't already see from their overhead and tax structure. Basically, they want a 10% increase in cash flow, profit, and equity value without changing suppliers or wasting time.
So
That usually means, go
I was
ahead.
going to say, so in our medical world, who would that audience be?
You might have a group of doctors that say own 6 clinics and have like 50 something employees. Great. We would tell that group of doctors, please expect savings of $50,000 to $200,000 per year without changing your suppliers or cutting any corners.
So this could be doctors groups, this could be hospitals, this could be
Yep.
clinics. What about
Clinics,
community health and behavioral centers, that type of?
especially those, yeah. They can be as large as a few thousand or they can be as small as a couple dozen. But every organization that has care professionals has overhead, everything from health insurance to property casualty and just your basic phone bill, credit card processing, bank fees, property taxes. And that's what our company audits, those overhead costs that are kind of a parasitic drain on the caregiver's profits.
Okay, and then I think the other piece that ties into that, I talked to a lot of people, engineers that are working in medical device companies. So
Mhm.
any type of company of that size, you can help.
Yeah.
So I'm getting a lot of calls right now because of these questions on federal funding. And, I know while we're waiting for the federal shoe to drop, and then the
Uh,
question, I'm in New York, and they're
right.
like, well, we don't know how New York is going to kick in. And I'm thinking, well, so why are we waiting to see what the damage is going to be after the bomb
Right.
versus getting prepared? We know that
Yeah.
there's a bomb coming. We're trying to get prepared for it. And so with DCI, my thought is that why aren't we getting ahead by working on the cost savings and the improvements that we can do without wasting time and
Mhm.
changing suppliers so that they've got that cush once
Right.
once it finally lands. So can you talk to that for a minute?
Yes, the goal is, as you said, to not be strictly reactive, but to find high ground before the flood begins, and or find the bomb shelter before the bomb goes off. We're expecting that a lot of caregivers, a significant portion of their company revenue comes from Medicaid. Not all of it, of course, but a good portion. And if it does, then when you have 20%, 40% of their Medicaid population no longer eligible, that has a knock-on effect to the revenue that comes to the clinics. So either those people are paying out of pocket or they're just not paying at all. And the net effect might be as much as a 10% drop in
Wow.
revenue year over year for a lot of these caregivers who are in safety net environments or uh, just has high Medicaid populations. So the goal is you would probably have to hit headcount times 2,000, 3,000, $4,000 saved per employee in order to offset maybe a 5%, 8% drop in Medicaid-based revenue.
Wow, that's a lot.
Yeah.
So specifically, as we're talking about these cuts
An
coming.
example, let me just list these five types. One, you are getting hit hard by the big, beautiful bill that's now the big, beautiful law. If you're a FQHC, if you're a rural health clinic, if you're a SNF, do any kind of addiction treatment centers, or if you're a safety net community hospital, those will be the highest concentration of Medicaid reimbursement revenue organizations. Not, all of them, but that's the big five. And the goal is to generate from a deep bench of expertise that DCI represents three major guarantees that the outcome has to have no disruption to patient care operations. Number two, it's going to have minimal time invested from the client's team. And three, it's got to be absolute zero risk, all contingency based, so that when this large amount of money shows up, it's accompanied by a very small amount of risk, essentially a small amount of energy and a zero amount of risk. So 100% safe, significant gain, small leveraged time, and without any exposure or downsides.
That's amazing, Kirk. So what you're saying is minimal risk to the management team because you're doing all the heavy lifting,
Mhm.
no impact for their client care,
Mhm.
and extremely low risk compared to what they're already doing.
Yes, it's kind of like the above all, do no harm, or first of all, do no harm. There's the client cannot say, here, I'm going to write a check for $30,000 and hope something good happens. And this is often the case in business. You are asked to believe and pay for promises, hoping that they come true. We would rather pay you rather than you pay us. We pay you the money, and it might come in the form of reducing your health insurance costs with Blue Cross. So you want to keep the doctors your people have. You want to keep the benefit level. Maybe it's a gold quality PPO through Blue Cross. You just don't want to be paying $3,600 or even $2,600 per family. You want to be seeing a premium down in the $1,600 per month per family or even lower. So those are those kinds of things that DCI does. We're not brokers. We're not selling policies. I'm not selling telecom. I'm reversing your telecom bill. I'm reversing your health insurance cost, and ideally showing you things that people who sell for a living either don't know or don't want the client to know. And so by leveraging our insider knowledge and our pricing databases, you're able to take advantage of significant gains without any offsetting sacrifice.
No, that's great. So that brings me kind of to the point that I know when you talk to clients, we kind of walk through the website to tell about what you do. So why don't we go there and
Mhm.
then you can walk them through how the process works from the beginning.
Sure. I'll happily
Yeah.
do that. And if they want to zero in on some very specific to caregiver examples, we can do that. But let me just take maybe a minute or two to give just the overall view, because this is not strictly for people in the caregiving world. We just say the company that's worth 50 million on Monday could be worth 55 on Friday. So we're targeting a 10% increase in cash flow, profit, equity value. And by 10% profit, we mean an extra 1,000 to 4,000 per full-time employee without changing suppliers or wasting time. So we have a very simple roadmap that describes our process. Essentially, on day one, we're given invoices to analyze. We come back 3 weeks later and we show the client where his cost savings are. Every company is different, but we can usually find a dozen recommendations. We only show the client the top five, so he's focused like a laser on the highest leverage use of his limited time and energy. And then when he approves, we're able to not only get the money, but verify the savings. When I hover over this purple dot here under get the money, this third and final stage, this shows a company, 130 people. We'll call this a medical supply company. Uh, they saved $500,000 just on their UPS bill. So
Wow.
same UPS. Thank you. No change in UPS or pickup or delivery or anything like that. Everything's the exact same. And that alone was a 10% increase in their cash flow, profit, and equity value. Just this one example.
So I
The
think,
goal,
Kirk, to that point, I think
yeah,
where people get tangled up sometimes when they're talked to is that there's a lot of firms out there that we call them boutique firms that'll do one thing. They're looking at your
yeah,
telecom, they're looking at a utilities audit.
mhm,
They're fairly invasive that they may show up on your property. And I know from my corporate days,
yeah,
they're there from a half a day to 2 or 3 days, gathering all this stuff,
right.
right? And they gather all this stuff and then they disappear for a long time, and then they give you a plan that they don't implement.
Right.
And
Exactly.
so back to what you were saying, if you go back just a little bit to that previous example that you had, what you're saying is that they already had UPS as a supplier, and you were
Right.
able to get better pricing on the UPS. And I think one of the examples I've heard before is that, okay, you may have the best pricing in New York City, but do you have the
Mhm.
best pricing in the country?
Exactly.
And that's the question.
Right.
Because your team, let's talk for just a minute about your bench strength. Who are
Sure.
these people, the people that are working for you, and how
Right.
can you get those
How
results
do we
without
do this?
actually changing
Right.
suppliers?
I joined this company back in 2003 as a utility analyst, and I knew you could run circles around the public utility with a pen. You could just use this pen, do this, and all of a sudden we did a large resort, the largest one in Arizona. Their energy bills in the summertime on their largest energy consuming meters dropped 25% with the
Wow.
stroke of a pen. They didn't buy electricity in the direct market. They didn't do retrofitting. They didn't turn off lights when they left the rooms. They just signed a piece of paper, what's called a tariff change. And that tariff change, with no downside, resulted in a 25% savings, which is a massive amount of money when you're in the middle of the Arizona Tucson desert in the summertime. So
Wow.
that meant you had large savings, and they can still do all the energy efficiency they want. But the goal is, if you're going to waste electricity, just waste cheaper electricity.
Exactly.
That's all I'm saying. If you're going to
Exactly.
waste cheaper stuff, right?
Yeah.
So
No, I
it's not,
think I
it's
think we
not
all
like,
had those dads that say, turn off the lights, and you're like,
yeah,
if,
right. So we're
if
not going to do the obvious thing of, hey, how about spend less money? Great. I'm not paying my consultants to tell me the obvious things. I'm having them here to do things that I don't even think are possible.
right.
So we really don't want people saying, "Oh, I want a guy that's, got no special talents and will tell me ordinary things." He really wants someone who spent the last 20, 30, 40 years of his or her career doing just Verizon mobile telecom audits and nothing else.
Yeah. So what
Or
you're
just,
saying is you want the specialist every
yes,
single topic, and we're going to talk about your topics in a minute. But what you want is, I mean, if you think about the medical field, if I need surgery done on my foot, it's not my general practitioner that's doing it. If I
uh,
need brain surgery, it's not my medical practitioner, my general medical practitioner that's doing it.
no.
So in each of the areas that you're looking at, it
Mhm.
is non-invasive. You're not showing up on the property. You're not closing down a hospital to do this work. And
Right.
you're taking the information, giving it to your team of experts
Mhm.
to do everything, all the magic that they do. And then the curious thing that you said is that you come back with a top five. So
Correct.
why are you focusing on the top five?
Because people, even more than hating to pay taxes, people hate to pay attention.
Good
I've
point.
got too
Me
many things
included. Me
going
included.
on. Right, right. We all in the hate taxes, but I'll say it's even harder to pay attention. So I have to say the 80/20 rule definitely applies. The top five out of 12 recommendations, the top five will generate 80% of all the impact.
Wow.
So everything else becomes a distraction. Now, the client doesn't know. He might find one or two or have suspicions, but usually his hot buttons are not where the money is. The money is
Exactly.
almost never in the hot buttons. It's almost always in the things that don't even look like buttons.
Yeah. I totally get that. I mean, I'm an engineer and I've had my own consulting business and all of that before I got into this.
Mhm.
And the problem was somebody would hire you to come and
Yeah.
fix something that they saw that was a problem. And after I was there for 2 days, I'm like, that's not the problem.
Uh-huh.
The problem
Right.
is upstream. That is a
Right.
symptom. And so even
Yes.
in the medical industry, we're saying, here's the symptom, but they're doing lots of tests and x-ray to prove where actually is the problem. So you
Mhm.
could kind of compare what you're doing as kind of an x-ray of
Yeah.
everything they've got and then comparing it to here's what the perfect health should be.
Hmm.
So you need, if you change these five things, you're going to be in much better health, have a much greater chance of
Yes.
survival.
Absolutely. Right.
Okay.
So those top five will mean the client will have to spend this number over here on our screen, which if your people are looking at their screen, they'll see it. It says one. I need one day from the man or woman who is running the show, who owns the company and writes the checks directly or indirectly. It's all coming out of his or her or their partner's pockets. And if they can give us one full day, 10 combined hours, 600 cumulative minutes, every 20-minute meeting we have, I just talked to a partner of a law firm, 20 minutes, he's looking at headcount times $2,000,
Wow.
all in 20 minutes. And his was in the IT, one of his
I
IT
see.
costs. Now,
Oh, interesting. So
that times five.
you can even audit, even for a small company, the
Oh,
IT
yeah.
services that they're paying for.
Yes, because they typically engage what's called a managed services provider. And it will not be a shock to find that a MSP is overcharging what they perceive as a well-heeled physician's practice that can afford it, and they're giving substandard care for super standard rates. And so we come in and audit and we say, we know exactly what this clinic should pay, what this hospital should pay. And if you're going to outsource, which may be necessary, that's fine. Just don't be the gravy train for that MSP
Yeah.
anymore. They've got a range of costs that they charge. We want you on the perfect end of the spectrum, not the 300% of necessary cost of the spectrum.
Well, and I think that's an excellent point, right? Because as I'm dealing with not-for-profits, a lot of them are outsourcing their financial work. And they're like, oh, we can't look at this because we've outsourced that. And it's like, no, you've outsourced it. And it's the perfect opportunity
Right.
to look at what's going on because you're hiring an expert from the outside. It's not
Right.
an internal employee to look
Sure.
and see what's happening.
Yeah.
And as far as some of these shared services, they're not necessarily deliberately ripping somebody off. Maybe they are, but
Mhm.
they may be giving them the best that they can. And what we're
Mhm.
saying is they're giving you the best that they can, but are you getting the best that you actually can have?
Right. In other words, I might say I'm doing the best I can to negotiate these prices. And of course, that's your honest best effort. But if I say my honest best effort is I can bench press 200 and something pounds, it's not Olympic benching, right? You need to bring in an Olympian and say, this is an Olympic bench. Boom. And it's going to be twice or three times the payoff when you bring in outside experts. Just like, again, if you brought in an outside specialist to work on a child's life, nobody would fault the general practitioner for bringing in a specialist. The parents of the child wouldn't blame you for being a bad doctor because you brought in a specialist. They'd be grateful that
They'd be
somehow,
grateful and getting
yeah,
a second opinion, right? So
exactly.
I'm not going to have my brain surgery done unless I've got a second, maybe even a third opinion, right? That
Right.
there's some conjunction in there. And I think one point back to what you're talking about, the one day of executive time, that's not one day from 8 in the morning until 6 o'clock
No, it's
as
cumulative
you need it.
20-minute meetings.
Yeah.
Yes.
And
I
this is
love-
the person is I think you mentioned this is the person that owns the money. So
owns the money,
you're not working with purchasing departments. You're not
spends the
starting at the
money. Right.
bottom. And tell us a little bit about why you don't do that.
Well, there is a natural apprehension that people have, if I may use this picture to illustrate what I mean. And it's a four-panel cartoon, but the second panel, the second of the four panels, is what happens when the CEO tells the CFO, we're going to do this because maybe the CEO is bonused on financial performance. He leaves the room, and then the controller comes in and says, you're a good CFO and I'm a good controller. Do we need outsiders changing things? She's afraid, just like all human beings are, of two things. I fear that I am going to lose control. If it's a bad project that goes haywire, they insult our suppliers and we have a mess, that's not good. But there's an even greater fear than losing control. It's the fear of losing face, as the
Yep.
Japanese would say.
Yep.
That is, we did this for a company, a well-known firearms company out in the Western Mountain region, and it was $800,000 savings just on the freight alone. Every
Wow.
company
Wow.
was
Almost $1 million in freight.
per year. Yeah.
Yeah.
And so they were all very happy, except one person who pulled us in. We were young and dumb. We were young and dumb and 40 something. And he pulled us into the office and he said, you guys have just ruined my career. He was the head of logistics. So he was feeling like he had lost face because how is he going to get a raise next year when the boss says, wait a minute, I'm already having DCI do this? What was I paying you for? And so the boss doesn't think that. But if the head of logistics thinks that his boss might think that, then there becomes a passive aggressive resistance. So that is the short answer as to why more money doesn't flow when the idea of outside experts are at least brought up because people say, I think we've got that handled. Don't you? Don't you think we're competent? Why do we need outsiders changing things? Or number two, they just have never seen an outside audit of any kind done. So with no point of reference, you have no idea what you're missing.
Yeah. Well, and I think, I mean, I spent my life in corporate America and I was traveling the world working at all these industrial plants. Certainly not as glamorous as it sounds. I was going to the third world areas of the third world countries to do my work. But historically, what happened, no matter where you were, what country you were in, everything in the pricing was all built on what was set to start with. Right. So they didn't have an outside person. And so every year you're going, oh, I think there's something that we always say is that you can be under budget and still overpaying.
Yes.
So because you didn't know the information, you go, man, I've maintained that price. And it's like, well, your
Yeah.
supplier is still making a nice, healthy profit. They
Right.
didn't raise your price, but they still have you.
Right. And it's not just a healthy profit. They're actually making more money than on you than they are on your peers and your competitors. In other words, you are losing ground to your counterparts every time you turn on the lights, every time you order a product, every time you insure an employee. You are losing ground if their cost structure is better than yours.
Yeah.
So yeah,
Interesting.
you can be under budget and overpay. And I will say that not only can it happen, it happens all the time, zero exceptions.
And I think when we're talking about the medical world, whether it's a hospital or a doctor's practice, their focus really, their number one priority, besides wanting to stay in business, is patient care.
Yeah,
And so they don't know what they don't know. And
right.
it's like, so you can come in on any of these organizations, get to
Mhm.
the heart of the matter in less than 30 days if you get the information
Yeah,
and show
exactly.
them and start implementing it. So they really could have money rolling in the first quarter that you start working with them. Is that correct?
That is correct. Speed to money matters. The ability to respond to stimulus is a sign of life, last I remember from my high school biology days. So the stimulus is a new
Paddles.
idea, right?
Yeah.
Says, hey, here's an insight. You could be reducing your health insurance cost by 31%. Really? How? Well, here's how. Boom, 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 boom. And then they'll ask some questions, and I'll say, good. Now that you know, how quickly do you want to institute this cost savings? If you're like, it's such a new thing, I don't want to be the one guy that stands out. But if you're the owner of the company, you're not worried about what other people think of you. You're worried about how do I not lose another $40,000 per month
Right.
overpaying for my health insurance or for my property and casualty or my liability or your E&O, D&O, utilities, everything that you see on this 9-dial dashboard. This dashboard is the source of all the money. And the reason it's the source of all the money is because this one cost efficiency dashboard with the 9 different examples uh, is the only thing all organizations, for profit, not for profit, not making any profit, white collar, blue collar, no collar, publicly traded, privately held, will not matter. They all have to have these 9 dials to some extent just to be in operation.
Yeah.
And so we bring together over 50 of the nation's absolute best, not guys that are pretty good, but people who are at the absolute top of the top. They're drafted into DCI Solutions. So we have what we'd call our all-star dream team of forensic analysts, auditors, people who know this business and where all the skeletons are buried and all the side doors and trap doors to access not just rate reductions, but refunds and rebates and unclaimed credits and bring it all to the CEO owner's attention. Maybe it's a CFO, it's a very large organization, so that when he or she sees the top five, they can say, it'll take 2 hours to implement this. All right, I'm going to assign that 2 hour project to Chuck. This 3 hour project, I'm going to assign to Susan. This 12-minute project, I'll do myself.
Yeah.
But they get to see the amount of money, the amount of minutes, and then there's one executive who shows up for 20 minutes at a time saying, hi, everybody, where's my money?
Where's my money?
That's
So,
the
Kirk,
best
some
way to
people may
start.
be watching this on their phone. So let's just talk through a little bit about what the 9 categories are. And I know you've got this. I know you've got this down to 9 dials,
Yes.
but buried in those 9 dials is a lot, right? There's a
Yes.
lot of subcategories inside of that.
Exactly.
So
Right.
when you look at, you've got a dial that says real estate. That's not necessarily rental properties, but it's what is all the costs and stuff that they pay based on the real estate that they're in there. So let's
Right.
just
Well, see, for
run through
example,
it.
this one would be a flashing sign here. We did Pete's Coffee and Tea, and you find a supplier, excuse me, a landlord is better at charging than the client ever is at auditing. And these guys make a full-time living, not just getting the bill uh, out on time, but including little discrepancies that inevitably work to the advantage of the landlord, property owner, but almost never to the advantage of the tenant. Right? If there's 100 mistakes, 99 will be in the favor of the landlord. And the tenant is outgunned. He's trying to,
Sure.
do what he does. And so if you do an external audit, you're using three criteria. It's external, not internal. Internal audits are not sufficient. They're just not.
Right.
External audit done by experts.
That
And in
that's
fact,
all they do. That's all
that's
they
all
do.
they do. They have to do after the internal people have done the work, the external person comes in as an expert. So it's not just a different perspective, but it's a different perspective that's better informed because they're doing this every day of their lives.
So you're
And
you're
those
saying
people,
if somebody's already gone in and said, I did a utility audit or I did a
yeah.
telecommunications audit, that you're still going to find money.
Yeah, because if they say I did it, I say, well, who? Well, Betty over there in the cubicle. I say that's nice. You should always check everything with Betty. But Betty could not possibly make, no offense to Betty, she's not going to make a full-time living going around auditing other people's stuff. Nobody would have her because they'd say, well, look, you do 30 minutes every month, you look at bills and you write okay to pay. That's not auditing. Auditing is necessarily external when it comes to the client's financial welfare. The internal audit says 2 + 2 = 4. He adds up and he says all the numbers add up. I'm not trying to add the numbers. I'm trying to change the numbers from 2 and 2 to 1 and 0, perhaps. So
Yeah,
1 + 0 now will equal 1, which is a lot lower number than 4.
I get it.
That
I get
analogy.
it. Yeah, because the question is an audit. If it's an internal audit, well, all you got's an internal audit, right? You don't have a
Yes,
comparison to anything from the outside.
right.
And your guys, if I remember right, you've even got some ex Price Cooper
You got
auditors
exactly.
on your team.
There's a wide variety of people who have Big Four experience and other single discipline that is not taught in any school, any seminar, any book. This comes through specific knowledge, as Naval Ravikant points out. People that have learned their craft through long 30-year apprenticeships within it. And
Yep.
so these guys, now journeymen and then ultimately experts, craftsmen, can identify how to reduce your Henry Schein supply bill 15% without violating the terms of your Henry Schein agreement
Yep.
or your GPO if you're part of a GPO. So,
I think I remember you saying recently that you've just picked up an auditor for New York City Water. And
so
you're
and
like, how can that be? And it's like, because there is so much stuff that goes with New York City Water. You
right.
actually do need an auditor to figure out if you're actually paying the right price.
Yes, you have uh, people who are genius at their unique skills that will they'll knock on doors and people won't listen. And if they do open up, well, good. Maybe there is savings in the water. But if the savings in the water is 4,000, but the savings on the gas is 400,000, you almost get distracted if you're
Yeah.
talking to boutique shops. We
Yep.
try to be a holistic solutions. We find 12, but I only show the client the top 5. And that way they're making the absolute best use of whatever 600 minutes we're going to require of them. Almost never do we need all 600 minutes,
Well, and
but
I would think that, I mean, as we talk about your experts and you're comparing that to the medical industry, your experts are like surgeons, right? They're special surgeons for their particular thing.
exactly. That's the best way to put it. They're highly specialized people who could write volumes on what they did that nobody else did within their field to generate these substantial gains.
That we don't want to read. We just want the money,
Want to
right?
read. I just want the money. Don't, no, nothing focuses the mind like someone's own money. So in the first meeting, when we're talking to our clients, I'm simply saying, you gave us 3 weeks ago the data. Thank you. Today, I'm going to show you your top 5 savings. They're in tax, they're in insurance, they're in your treasury, they're in your supplies, they're in your whatever it might be.
This could be any place you're spending money in a hospital or any
Yeah,
place you're spending money in
exactly.
practice.
Yes, anywhere. But there are some things that pop up. So in general, we tell folks just to please expect headcount times 1,000 to 4,000, and it will all be from some combination of these 9 dials that are part of this one unified cost efficiency dashboard. I can give specific examples for people that really want to get to the meat of it. Would that be a good thing to do, or
Sure. Why not? Pick one
I'll I'll
that'll work for call it a medical practice
I'll
hospital.
call this best practices, and we'll breeze through it real quick,
Okay.
okay?
Yep.
So this is a hospital out in Illinois. Here's their savings on Henry Schein, on Medline, on card processing, long-term disability. This is their close-up of the long-term savings. They were using Aon, which is one of the top 5 brokers in the nation. People say, well, I got a top 5 broker, therefore my costs are perfect.
Means you might be paying one of the top 5 costs.
Yes, exactly. That might be, uh,
You're paying for a name, right?
or yes, you're paying
It's
for a
like
name.
you're living in California, you're getting paid in sunshine, buddy.
So we would say to these people, you've got a great broker. He's very nice. She's very pleasant. They're all wonderful, great service. But why not reduce the cost? In this case, it was almost $300 per employee, just on disability, dental, and things like that, not even major medical. This is the supply audit for a company that had a GPO. Saying GPO, we don't violate the terms of your GPO. Nothing changes, but the costs go down by 11%. These are two different companies. This is an audit of your credit card processing. This particular care provider, $16,000 per month in savings on their credit card processing. Here is another care provider, one-third of $1 million saved on their bank fees. So if you've got 5 million in the bank, that's about when you'd want to have you you would probably expect to see some savings
Yep.
on your bank fees. This
Well,
particular company had 19 million.
in both of those situations, you're talking about bank fees, but you also talked about processing fees. And these are things that, when you're serving patients, these are sort of invisible things that you're not paying attention to
Exactly.
so much.
Right. So you can
You're
reduce
thinking
those
about,
costs,
yeah.
rebate those costs. Yeah, so we do everything, keep it very simple. I try to show the client the number you're paying in red is the number we're going to stop. Blue is the opposite of red. So when we go from red of $330,000 in bank fees to zero in bank fees, that represents the number in green, the $330,000 savings. This is for a behavioral health hospital out of Kentucky, multiple locations. This is for companies that are for profit who are trying to reduce their tax burden. That's a great idea. This is explaining how you can reduce health insurance. This is free advice for your larger clients who are self-insured. And they'll say, well, Allie, we're self-insured, therefore we're home free. Nothing left to save, right? Wrong. 100% wrong. So we actually show clients when you're self-insured, this is how you're getting hosed on your stop loss policy.
Mm.
This is a complimentary 401k analysis we did. We're actually meeting with a skilled nursing facility. Their free forecast is going to be about $500,000 just on the
Wow.
401k fee.
Now you're
Well,
sort of in my territory when we're talking about
oh,
401k. So the assumption I think on a 401k is let's say you've got a big hospital and you've got all these employees.
right,
Somebody's taking care of that for you. Where is the
right,
money that you're finding in these 401k plans? It's not from the employees. What is it?
right. No, well, some of the costs are borne by the employer. Most of those costs are borne by the employee. But you have unnecessary expense ratios. You've got Class A shares instead of a class that pays a lower commission. So a Class A shares might work when your 401k is under $1 million. But now you're getting to 5, 10, 50 plus million in 401ks, and you're still being drained by these parasitic commissions hanging on each of these funds.
Meaning you've never gotten elevated to the status that you've grown to. They're keeping you in the minor league,
Yeah, you're
right?
wearing your little girl shoes and you're a grown woman. It's like these now I've
Right.
got those like shrunken feet. So we take off the restrictive costs that are restricting the health and growth of your 401k retirement. This is for people that are trying to find ways to larger caregivers, nurse turnover, average nurse loss is $40,000 per position.
Wow.
So if you can save 20 positions in a given period of time, that for some organizations, that might be a year, others might be a quarter. But if you can reduce 20 positions of turnover in any given period of time, year over year, then that might be $800,000 savings. This is for larger organizations who are looking for ways to do what's called reverse factoring. This is for remote patient monitoring. Companies that are already doing it really well. How do you help somebody who is great be greater still? These are a couple slides exampling that. We can do a free forecast using this particular data. And there goes that cartoon you saw earlier. Here on the left, external perspective, deep database of the 1% pricing, zero change. And again, the client's free to either accept or reject the recommendations. They're never forced to take money they don't want to take. So if I put $1 million, which we've put large amounts of money on client's desk, and sometimes the client says, can I have 3 months? Sure, take 3 months. You're just losing 50 grand.
Exactly. You're losing money.
Now, it's not usually the owner of the company. It's usually the CFO who says, I need time. The owner, if he or she were to know, would say, we're doing this next
The
month.
owner's like, that stops us from having a layoff. That stops this. This
Exactly.
allows us to do this project. This allows me to go on
Right.
vacation, whatever it is. So, the
Exactly.
question is, and I've said this to people, it's like, if you actually had an extra $2 million, what would you do with it?
Yeah.
And it's not my job to figure out what they're going to do with it, but they all know what they would do with an extra $2 million in the organization, right? Or
Yep.
$10 million. I mean, you can do 10 million.
Yeah.
Back to
Exactly.
back to your website, you had I don't think you discussed the chart that goes up and to the right
Okay.
and how
The
you
up and
actually work with
right.
organizations.
Right. So remember we said there's three X's: external, experts. What would that third X be? You've got to find a way of motivating, incentivizing the world's best or at least I'll say the nation's best. I don't know what they're doing in China or Indonesia. I'll say the nation, our nation, United States, the nation's absolute best experts. How do you motivate them? You've got to excite, you've got to incentivize. So we'll say that third E, that third X is external experts who are excited, just like in a catalytic reaction. You've got to excite a chemical reaction that goes to your engineering training to do something. And so we say, Mr. Client, you're the green, we're the orange. If that excites you, we're excited with you. We will make this happen. We will put all the money on your desk, and then we will let you say, I authorize the first, second, and third recommendations to begin right away, and let's wait on four and five, or let's do all five simultaneously, your choice. But each of those five savings that we identify would be substantial in its own right. Combined, the five would definitely increase your cash flow profit by an extra 1,000 to 4,000 times 2 dozen, several dozen, several hundred, a few thousand, doesn't matter the size of your head count. It's all linear and proportionate. And in this case, we're showing a client that is clearing a couple $100,000 per year, every year forever. We share equally, which is what the orange is, with the client, but only after they get paid first. So if I may give a basic example, this is how we keep our clients safe. In November of 24, we measured this company, that same one we referenced earlier, their freight savings for the month of November. It was $48,000 in that given month. The client retains 24, they pay DCI 24, but they don't pay until after November has passed. Now we're in the month of December 4th. The savings are measured, verified. Now the client's invoiced. So cash flow positive always means you're never paying for something that might not appear. We are
But
always
I
producing
think
and
I think one point when you talk about that, so basically, there's no sharing of the savings until you've actually found the savings,
exactly. The
right? So
savings have to
all the
be
upfront work, all of that stuff happens without any cost to the customer.
exactly. We're basically digging a canal of water and we're saying, can we both drink from it? And then after 3 years, we leave and the canal is yours exclusively. So during that 3 years that we're both sharing equally from this flow of money, great. This is what excites DCI to um, bring to the client the very best consultation on a risk-free basis without changing suppliers or wasting time. So we usually tell our clients, you again, back to that thing you have to pay. When we say pay attention, we mean three things. We say either A, say this sounds great, I'm doing it now, let's get cracking. Or this sounds great, but I can't do it for whatever particular reasons. Keep me on your mailing list. Or three, I'm never doing this because I can't stand the thought of outsiders knowing something and leveraging their knowledge to enrich myself. But let make it one of those three. Please do not make it, wow, I'm really excited now. And then for the moment you're focused, and then you're distracted by the squirrel or the shiny thing that goes running by. And when the call comes from DCI, you're saying, I can't meet right now. I've got a squirrel to chase. Do not be that person.
Keep
So
your eye on the money. And I think
you're on the money.
one
Yeah.
thing I'd like to clarify, Kirk, is that we talk about this and we talk about the sharing. This isn't like a firm that comes in and gives you a plan and says, "Good luck. We're gonna share the money for the next
Yeah.
2 years." The difference in what you do, if I understand it correctly, is that you guys are auditing every bill that comes in, and
Every single bill. And there's a reason for that.
I would say, at home, if you've got a cable bill or your phone bill, and you look at that once a year and you go, "Why are they selling me the sports package when I don't even watch sports?"
Right.
And that your suppliers are always adding more stuff in there, especially when you start taking things away, they're trying to
Mhm.
sneak things back in. But what we're
Yes.
saying is, instead of the client having to hire people to enforce this, they're not
Right.
hiring anybody. They've already
Right.
hired you. You're getting
Right.
paid based on the savings, and every single invoice that comes through, you're on
Right.
top of it and helping to make sure that they get the money back.
So let's just not underestimate the cleverness of human beings. Okay. Do not underestimate the cleverness of your vendors. They will smile and give with the right hand as they claw back with your back turned with the left hand.
Do you mean
And
even the people that are sending you fruitcakes and
yeah, even
Christmas
if people
candy and
sending you
stuff?
fruitcakes, exactly.
But
So
they like me. They
your
like me.
laundry and linen
So aren't
suppliers, your credit card processors,
aren't they giving me a good deal if they like me?
there are certain notorious, there are certain groups that are notorious for giving with the right, taking back with the left, and they have to be retrained. Like when you get a new puppy, they're not house trained right away. You have to catch these guys trying to trying to abuse the client, usually in month 13 or month 33. And once their hand gets slapped a couple of times, they give up. At that same time, we're doing the IP transfer to the client. So we're not just
And
saying,
and
all right,
and
this
and
is
this
work,
and the
walking away.
supplier's going, how did Susie get so smart, man?
Exactly.
Every
And
time
they'll
I
think, how
stick
did
something in
Susie?
here,
She's figured out my game. She's really well because Susie behind
she's
Susie
been trained
walking
by the
with her
experts.
every step of the way.
Yeah,
We're auditing, and then we're also saying, now this is how they slip the puck past. Like in baseball, don't fall for the hidden ball trick. Do not get tagged out with a hidden ball trick, right? There are certain things that people do routinely to catch you when you're off guard, and you lose while they profit. So that's why we have to not only put in place but keep in place, just not analyze, but analyze and audit over that entire 36-month period until the vendors learn not to torment you with little tricks. And
right.
number two, if they did try, by that time, Susie is wise to their ways and
Yeah.
knows what to
And
do.
and you know it's going to stick, right? In 3 years,
Yeah.
they've given up because they're concentrating on the hidden ball trick with somebody else.
Yeah, and they're gonna go after somebody who's more trusting. You don't have to trust or not trust. You simply have to engage DCI,
That's a
and then
good
we will
point.
give you facts, and then facts are better than trust.
Yeah, that's a good point. So, a couple questions for you, Kirk, as we wrap this up. Is first one I would say is, why can't they find this money themselves? Don't you get that objection a lot? It's like, well,
Yeah,
we're working on this. We'll just go find this ourselves.
yeah. See, I'm going to speak again to people who made their life devoted to medical care. Now, imagine you do a life-saving procedure on somebody, and it takes you, the professional, less than 15 minutes. And let's say someone is watching you. Let's say it's the father or mother of the child. They go, "Ah, I can't believe you're charging me for something I probably could have done at home." And you're trying to tell them it took me this many years to make that 15 minutes meaningful to your child for the rest of his or her life. It may look easy, but that's what professionals do. So I would simply tell folks, do what you want. But when you're ready, after all you've done already, uh, to see how much additional money's there, I will tell you, after all you've internal initiatives and other external audits, DCI will give you an extra $1,000 to $4,000 on top of whatever you've done. So it doesn't matter what you do today or tomorrow or next month, the money is still there. Actually, it's being forfeit, but the opportunity is still there to reverse that loss and turn it into a gain. But you cannot expect, and you should not uh, expect your CFO to figure this out or your controller to just do a better job. It's a very unfair, and back to the way we talk about losing face.
Yeah.
That mindset is what causes your subordinates to think, oh my gosh, if DCI did come in here, my boss would then say, well, how come Chuck didn't do this himself?
Yep.
So you got to be careful. This is what professionals like DCI do full time, nothing else.
So, Kirk, I remember, I spent a lifetime in the corporate world and many years dealing with quality, not because we had bad quality, but Six Sigma, all these
Yeah.
projects. And I am sure that in the medical world and hospitals, they've got quality people and Six Sigma projects going on all
Yeah.
over the place, right? I
Mhm.
also remember, and this was before the Zoom days, I remember flying all over the country, sticky notes on the wall, all of
Uh-huh.
this stuff. And I
Right.
think one point, from the world that I came out of is that we're not looking at process improvement. They can
No.
do that as long as they want. We're
Right.
saying, in a short period of time, we can take all this money off the top that we can find that you can't find. So you really you can focus on the things that are important to
Right.
you, to your hospital, to your patient care. That's where their priority should be, because you can
Sure.
come in and outsource this to
Hmm.
to DCI and then come up with this and implement it, and it's painless and it
Yeah.
keeps you focused on your mission.
Right. And if you're more money means more mission. And if you're
Yeah.
losing money because Medicaid is maybe impacting you by multiple percentage points on revenue, then this is bringing back the money the BBB subtracted.
Yeah. Well, and it's
So,
not only that, right? It's not only that. We've been going through this for years of working with the insurance companies that they're adjusting what the reimbursements are, that
right.
type of thing. And so
Yeah.
even before the BBB, we've
Yes.
had these issues of, well, how do we do more so we can make
Right.
more money, because they keep changing the rules. And this is how you
Exactly.
deal with changing the rules. Wherever the rules are coming from, you're getting ahead of it because you're finding the money. Okay.
Yes. and
So
we're laying
what's
the platter before the client. So the
so
client
what's
gets,
it costing them to wait? And why would they wait if there's no upfront cost?
well, if I just do the math real simply, let's say a company listening here, you're the CEO of, I'll take a nice number, 1,000 employee rural hospital group. Okay. Well, we're saying 1,000 times 1,000 is $1 million minimum. So 12 months means every month lost is almost $100,000 a month, about $83,000 a month. And we can prove that. We can prove that the amount of money you lost in, let's say, the month that's already passed, March of 2025, because you didn't know about DCI, you weren't able to use us, but we can show that compared to what you would have paid, you overpaid in March of 2025, $83,000 in that 1 month alone, just based upon whatever the top five recommendations. And we don't have a time machine. We can't go back. And I don't want people to feel bad that
Yeah,
they didn't start earlier. But I would feel bad if I were delaying an obvious, safe,
right.
high profit decision to at least, as you said, get ahead of it. And if there's a rising flood coming, well, maybe I get to high ground now. That's considered a prudent executive decision.
Well, it's like when you go in and a doctor gives you a diagnosis for something
Yeah.
bad that you need to deal with. Are you going to take action on that then? Are you going to go, you know what? I think I'm going to wait a year. We're going to think about
Uh-huh.
this for a year, and
Uh-huh.
maybe we'll look at it then.
Yeah.
So it's not the goal. We're trying to say, how do you get in front of it? There's no
Yeah.
cost to do it. I think is the starting point. They can
Yeah.
contact me. They can contact you. It's a 25-minute call.
Take,
You walk
yeah,
through.
25 minutes. I would go through and find out what they want to do. But we make it very clear we're not asking for retainer. There's no upfront cost. There's no per diem. There's no travel. There's no anything that you usually get from the usual consultant rigmarole. And
Yep,
we've all seen that, maybe even done it in our lives. It's behind us. It's not even in this picture. It's if you give us the one thing you must pay, which is the attention, and you give us the data, then when we show you the top five, all I want is a full mental engagement so that you
yep.
can say, Kirk, this is what we want to do with the top five you've shown us. Thank you for not showing us 12. We couldn't possibly handle all those wonderful dollars, so we're just going to focus on the top five.
Well, and I think you've said before that if you can get 25 minutes of who owns the money, the CFO,
Yes. Man
CEO,
or woman who owns the
business
money.
owner, if you can
Mhm.
get 25 minutes of their time, you can find their week's salary in that 25 minutes.
Yeah, that's the simple analogy. Let's say you are a partner where in your medical concern you're paid $1 million a year. Maybe you pay yourself $1 million a year. That means you pay yourself $20,000 a week. That means I have to pay for your entire week's salary in a 1 hour meeting. So every time I meet with you for exactly 1 hour, I will have net of all fees, $20,000 on your desk. That is the criteria we operate by. If other people can do more than that, maybe we should wait our turn. If you're not finding anyone who guarantees your 20,000 or whatever your week's salary is per 1 hour of meeting time, then I would suggest you maybe get in contact with Ali and we
Yeah,
can all
get in
have a
contact with me. And what I would tell everybody out there that's listening in radio land or TV land, whatever it is, I spent my life in process improvement, and like I said, traveling to really weird places. A lot easier to save $1 in America than to save it
Mhm.
in India when I'm trying to convince the people in the plant just to put on shoes if they're rolling cylinders.
uh,
So bigger challenges everywhere. But what I can tell you is that when I met Kirk, started working with Kirk and looking at all this, they do it much easier, much faster, much
mhm.
less painful than what you see out there, right?
Right.
There's a lot of stuff, and there's always somebody that's vying for your time. All we're asking for is 25 minutes if you're serious, by the owner of the money that's going to make the decision. And if you
Mhm.
say yes, I like it, it's a very short agreement, and then we're off to the races.
Yep.
So thanks for tuning in. We'll put the links in the YouTube channel as far as reaching me and DCI's website, which is what he was walking you through. Kirk, thank you so much for your time today. Always fun. Love your stories. And
Thank you.
let's go help this industry get some money ahead of the tax cuts and the
Yeah.
federal cuts, and put them in a better seat than being reactive. So
Wonderful.
thank you.
All right, Allison, take care. Bye bye.